Welcome to Talk of the Town. Dieesha Hicks has joined us once again. As you know, she is the State Health Insurance Assistance Program actual coordinator for the entire state and manager at her local office. Dieesha, October 15th, we began the open enrollment period, and so it is going on. I want to begin by asking you, is it being affected at all by the government shutdown?
It is not. Open enrollment is still moving forward as per prior years, so there shouldn't be any problems. I mean, I can't predict the future, but as of right now, it is rolling streamline ahead.
Okay, that's good. That's good news, Dieesha. I love that. So, for folks that have done nothing, they need to go and review their plan, even though they probably were going to stick with the same plan, but that review is important, right?
That review is important every year. You just want to make sure that your premiums haven't increased to a ridiculous amount, or make sure that all of your drugs are still on that plan's formulary. There's a lot of plans that will be leaving our area. I've seen some of the drug plans where the premiums have gone up by $50. So if you're not paying attention to this, you can definitely be affected for 2026.
All right, and for our viewers that still might be confused about the difference between just regular Medicare and then also Medicare Advantage, you want to give us the difference.
So original Medicare, that's your red, white, and blue card that you get that has Part A and Part B on it. That is original Medicare. That's for your inpatient hospital stays and for your doctor's visits, durable medical equipment, and things like that, things that are considered outpatient. The Medicare Advantage plans are plans that are contracted with Medicare to pretty much provide the insurance for you. So let's say Blue Cross. Blue Cross would act as your Medicare, so that would be your Medicare Advantage plan. And you will use that at the doctor's office, in the hospital, in the pharmacy, instead of your red, white, and blue card. Although that never goes away in the background. Blue Cross would just be handling your insurance.
All right, and you have to have certain physicians that are in network, right, with the Advantage plan?
Right. Right.
Okay.
So within that Advantage plan, you must see doctors that are in that plan's network. If you have original Medicare, you can see any doctor in that plan's network. I mean, any doctor that accepts Medicare in the country.
Okay, so Dieesha, during this period, it's October 15th through, is it December?
December 7th.
December 7th. And so we need to be looking at our current plan, making those reviews, and let's say you don't do anything. Does it just go over to the next year the way it is?
If you don't change your plan, it'll just keep rolling till the next year. And it's not mandatory that you change your plans. You just want to make sure that everything is still right for you. Because we see a lot of people that get caught up in, I'm so comfortable with this plan. I'm comfortable with this. I'm comfortable with that. But again, things change every year, and you don't want to be left unknowingly with something that maybe you cannot afford. Or there may be something that was cheaper that was just as good or better than what you had.
And is it important to review is it the prescription plan and like your supplemental as well?
No, not your supplemental, because you're kind of in there once you get that supplemental. But this is the time to review your Medicare standalone drug plan and your Medicare Advantage plans.
Okay, very good. So any other tips for us as we wind up this interview for this month?
Listen, just don't be nervous about checking your plan. I mean, they're not going to be mad at you for checking it. This is really about you and your health care and your needs and your wallet. Like, who wants to spend unnecessary amounts of money when you can make a change? So you're not obligated. Just remember that. Beware of those scam calls. Remember, Medicare, Medicaid, nor Social Security is going to call you first. Okay. Watch out for the mail. Don't believe everything you see on Facebook. That's my tips.
Okay, no, that's excellent. Very, very good. Well, always great information. Thank you so much. Again, open enrollment began on October 15th, and it will close on December the 7th. Thank you so much, Dieesha Hicks.
Thank you, guys.
Appreciate you being with us once again.
You're welcome.